Also, during cold and flu season, hate to say it, guys, but please try to avoid crowds if you can. If you know that in this peak cold and flu season, you're going to want to avoid exposure to the malls, possibly even to church. If you do have to get out and be in large crowds, please keep your hands clean. Have hand sanitizer with you. Avoid putting your hands in your eyes and on your mouth. Very, very important. Again, that's part of promoting your health. Two very important topics in promoting your health. Get plenty of rest. You've earned that right. Many of you have worked for years, you're retired. I know many of you are sitting more than you ever imagined that you would. However, you use a great deal of energy just to breathe comfortably. So it's very important that you get the necessary rest that you need. Make sure that if you have been prescribed oxygen or you are on sleep equipment at night, that it is working appropriately. Thank goodness for home health. They will keep track of that with you. Again, though, if you have any questions on how to properly use your home oxygen or your sleep apnea equipment, please contact your home health. I'd like to talk about possibly your least favorite topic, and that is exercise. The last time I spoke, I concentrated on talking about exercise does not have to be in pulmonary rehab. And I focused on one statement, and that is exercise is movement. What I'd like to follow up with today is for those of you who are committed to exercising in an exercise environment, be it a pulmonary rehab setting, be it a gym, or you're fortunate enough to have a treadmill or exercise bike or both at home. Exercise is intended to maximize your functional independence. When we have a breathing diagnosis and we are suffering with shortness of breath with activity, you find that you are sitting more than you ever intended, as I had mentioned. As a result of that, your muscle groups have become increasingly more weakened. I use the phrase robbing Peter to pay Paul. When the muscle groups have become so weakened due to inactivity, the oxygen that you're breathing in that is intended to filter through the lungs to get to the muscle groups, your muscles that are deconditioned require more oxygen to work. So when you move, your breathlessness is intensified. Pulmonary rehab is intended to offset that balance. It is a gradual process. For all of you that still think that you're 18 and the phrase no pain, no gain applies, it does not apply in the pulmonary rehab setting. From the standpoint, Christina has brought up an excellent approach to exercise that I am using with our patients as well. And that is try to increase the amount of activity with your exercise by 1 minute each time you come into exercise. When you are exercising, do a self-check. Make sure you check to see what your energy level is for that day. With the rain that we've had the last 3 or 4 days, today in pulmonary rehab, what we noticed was greater difficulty for some patients to breathe comfortably. So what we are hoping our patients have heard us instruct is that is not the day that we're going to recommend that you increase your activity level. If you are having a difficult time with your breathing and breathing comfortably, then your goal for that day is to exercise until your body lets you know you've had enough. Either your muscle groups are saying, I'm tired, or your level of breathlessness increases. The recommendation for the number of days to exercise is 3 to 5 days a week. Trying to give a day in between each exercise session for your muscle groups to rest. Walking is the best exercise. Use your rollators, canes, adaptive devices when needed. If you have a pulse oximeter, keep it in your pocket. It takes away the guesswork. If you start to get short of breath, you can check, and if you find that it's going below 90%, that's letting you know to either slow down and stop or discontinue the amount of exercise for that day if you're really that overly fatigued. Always exercise safely. If your exercise consists of walking at home outside, check the weather report. If the weather conditions are not conducive for your breathing comfortably, then you may want to think about going to the mall and walk inside. If you need your oxygen with exercise, check the amount of oxygen that is in either your tank or the battery life of your concentrator. What you are doing is you are preparing yourself to exercise comfortably, safely, and most importantly, successfully. If you need to use breathing medicines before you exercise, you use your breathing medicines as prescribed. Don't be afraid if you have been prescribed to use oxygen and your breathing medicines or inhalers. Please use them as the doctor has ordered. They're intended to ease your work of breathing. Always prepare your body to exercise by stretching. Simple stretches, calf stretches, just moving your arms up and down before you get ready to do your extended walking or riding on a bike. Very, very important. It also helps to prevent injury. Always exercise in a well-ventilated area where the room temperature is comfortable for your breathing. All of our patients will tell you we keep it very cool in pulmonary rehab. We find our patients breathe much more comfortably in a cooler environment. If exercising by yourself, if you are in a retirement community or an apartment complex and they have an exercise room and you're going to exercise typically at a time when no one else is in there, please have a cell phone with you. If you find that you need help, then you've got a way to contact others. Because if we need help when we're short of breath, the last thing that we want to need to worry about is that we have to walk to find the help. So please have the cell phone with you. If you don't have a cell phone and you're going to exercise, have a buddy that you let know, I'm getting ready to go exercise, I should be back in this amount of time, this is where I'll be. Again, exercising safely is the most important thing. Make exercising a top priority and set realistic goals. And I have a quote, remember, Rome was not built in a day. It is a commitment that you are making to make improvements in your health and general well-being by committing to exercising a minimum of 3 to 5 days a week. I would love to be able to tell you that we are open 5 days a week to allow you to exercise 5 days a week, but that is not the case. We do want you to allow your muscle groups to rest in between each exercise session. The benefits of exercise: improve independence, reduce isolation. One of the favorite parts of pulmonary rehab for Christina and I is the fact that we are afforded the ability to get to know our patients. Once a patient is ordered into pulmonary rehab, in our particular program, we will send a renewal order to the physician. We've never been turned down, thank goodness. But we have patients that we have worked with for many years, and that is the favorite part for both of us because we really do get the opportunity to get to know all of our patients. Consistent exercise reduces sensitivity to breathlessness. Your muscle groups become stronger, they require less oxygen to work, therefore your sensation of breathlessness is reduced. I cannot tell you that pulmonary rehab will completely get rid of shortness of breath. Unfortunately, that is a part of your diagnosis. I can tell you, though, that we are here to help you learn how to manage that level of breathlessness and to help increase your strength and endurance. Exercise improves efficiency of breathing. Most importantly, exercise improves your confidence. The last piece before I turn it over to Christina, the benefits of pulmonary rehab. It improves quality of life. Pulmonary rehab improves perceived breathlessness and exercise capacity. Pulmonary rehab reduces hospitalizations. Of our patients that have been admitted, for the medical term for a flare-up is called exacerbation, we have noticed that our patients' hospitalization stay is fortunately shorter. Pulmonary rehab helps to reduce anxiety and depression. I think that is a key piece of the puzzle that unfortunately all of us become very embarrassed about in talking, that we may feel anxious or depressed because we have a breathing problem. Please never be afraid to bring this up to your physician. He will have excellent suggestions on how to better manage it. For any of our patients, we are very free to speak with our patients, especially in the beginning with the initial assessment, that with shortness of breath, understandably, anxiety is right there. It's the body's response to feeling that you can't catch your breath. Pursed-lip breathing is also a valuable tool in helping to reduce that anxiety level with your level of breathlessness. The most important thing for pulmonary rehab, the benefits extend beyond the initial 6 to 8 weeks that most programs, and exercise is a commitment you make to yourself for the rest of your life. Our pulmonary rehab program is physician referred. Our patients come in 1, 2, or 3 days a week. As many of you know, transportation can get to be an issue, and if that's the case, if we can get a patient to come in 1 day a week, I'm thrilled. We encourage our patients to call on the phone with questions. If we can't answer the phone, we're in the middle of assisting other patients, we will return the calls by the end of the day. Christina and I will tell you that we are an extra set of eyes and ears for your referring physician, in that if we feel that something is going on that your physician needs to be made aware of, and it is not an emergent situation, we will strongly encourage you to contact your physician with your symptoms. Early intervention is the key. The sooner you are treated, the sooner you recover, and the sooner you're able to get back to your comfort level with your daily activities. If you have had a flare-up and you've not been able to exercise for 4 or 5 days, when you come back into exercising or come back into pulmonary rehab, please remember to reduce your times on your exercise equipment. You are just like that Olympic athlete in that when you stop exercising, your muscle groups are like, yay. And those muscle groups just get back down to a relaxed state, and they need to be awakened again on a gradual basis, and you need to then start that by gradually increasing the time on the equipment, 1 minute a day.